Welcome back. As staff are returning to the workplace in JCPS, several measures will be in place to help reduce the risk for spread of COVID-19. These are centered around the 5 principles outlined by Governor Beshear and the Department for Public Health regarding the return to work in school. They include 5 principles. Those are social distancing, cloth face coverings, screening and exclusion from work when ill, sanitation and environmental factors, and contact tracing. Let's talk about social distancing. Social distancing is limiting face-to-face contact with others, and it's the best way to reduce the spread of coronavirus disease, or COVID-19. Social distancing is also called physical distancing, and that means keeping space between yourself and other people outside of your home. To practice social or physical distancing, stay at least 6 feet or 2 arms length from other people. Do not gather in groups, and stay out of crowded places and avoid mass gatherings. Cloth face coverings. Wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain is recommended by the Centers for Disease Control and Prevention, or CDC. Kentucky Healthy at Work guidelines call for universal employee masks. Please note that face shields are not the same as cloth face masks, and the CDC does not recommend them as a substitute for face masks. When returning to work, sites will make masks available, or employees may choose to wear their own. If you elect to provide your own mask while at work, you must follow these guidelines. The mask must completely cover your mouth and nose. Bandanas are acceptable, but they must follow the CDC guidelines. No inappropriate logos, images, or language can be visible on the mask. So how do you wear your face covering correctly? First, wash your hands before putting on the face covering or mask. Put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure you can breathe easily. Wear a face covering to help protect others in case you're infected but don't have symptoms. Wear the covering in public settings when you're around people outside of your household, especially when other social distancing measures are not available. Don't put the covering around your neck or up on your forehead. Don't touch the face covering, and if you do, wash your hands. The cloth face coverings recommended are not surgical masks or N95 respirators. Those critical supplies must continue to be reserved for healthcare workers and other medical first responders. Some people will need these in their JCPS workplace if they're caring for students with medical needs, but most staff will use cloth face coverings. In some situations, a cloth face covering may make a physical or mental health condition worse. If you have a concern, please check with your healthcare provider for guidance. Health screening. Employees will fill out a health screening form each workday. This form can be found on the district webpage. Employees will sign into the employee portal and complete a form every day. The form has questions about possible symptoms of COVID-19. Anyone with cough, shortness of breath, difficulty breathing, or a temperature of 100.4 degrees Fahrenheit or greater, or those who have 2 or more symptoms that include fever, shivering, headache, new loss of taste or smell, chills, muscle pain or sore throat, or if you live with someone with a current diagnosis of COVID-19, you should not be on site. Sanitation and environmental factors. Washing your hands is one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another. So how should you wash your hands? Well, wet your hands with clean running water. It can be warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Do you need a timer? Hum the happy birthday song from beginning to end twice. Rinse your hands under clean running water. Dry your hands using a clean towel or air dry them. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. You can tell if the sanitizer contains at least 60% alcohol by looking at the product label. So how do you use hand sanitizer? Well, first, apply the product to the palm of one hand and be sure you read the label to learn the correct amount. Rub your hands together. Rub the gel all over the surfaces of your hands and fingers until your hands are dry. This should take about 20 seconds. Contact tracing. Contact tracing is part of the process of supporting patients and warning contacts of exposure in order to stop chains of transmission. When a case of COVID-19 is diagnosed, the case is investigated and contacts of that person will be notified. For more information about how contact tracing will work in Kentucky, go to Kentucky's Contact Tracer and Tracker video. If there are concerns about areas that are not complying with the return to work or school guidelines, these can be reported at the Kentucky Safer website. If you have questions, you can also reach out to the Health Services Office at 485-3387. Thanks. Do what you can to keep yourself and others safe. Welcome back.